Okay, here is a small video. I hope the sound is okay today. Today I'm going to talk a little bit about research on antidepressants and antipsychotics. Not because I necessarily think that they are bad drugs. Some people like the effects of antidepressants because they numb them so that they don't feel so much. Unfortunately, they numb them in many areas, including sex, so that they don't feel much desire or love or things like that. But in emergencies, okay, I can understand that people want to be numbed. When it comes to antipsychotics, people say that they stop a little bit the racing thoughts, and I can very well understand that sometimes people want to have their thoughts stopped. What is important to consider is, of course, the side effects. That on both antidepressants and antipsychotics, it might be very difficult to get off. So if you take it for a short time, you might not be able to get off it, even if you want to. So that's a consideration to keep. But my point of view is that people should be able to choose, but they should also be informed, properly informed. And that's why I want to focus a little bit on the research, because we depend on research to know if these drugs are useful. So the typical research design is as follows, both for antidepressants and antipsychotics. You take as big group as you can of people who are already on either antidepressants or antipsychotics. In the case of antidepressant research, you take people who are already on antidepressants. So let's use that as an example. Let's say that you take 200 people. You're lucky enough to get 200 people who want to try the new drug that has been manufactured by a certain manufacturer. Okay, so you take all of them and you jerk them off the drug that they're on, an antidepressant. Then you leave them for 10 days in a way to wash the drug out of the system. It's called the washout phase. And then when you have when they've been 10 days in withdrawal, then you measure them and see how depressed they are. And usually people get quite a lot worse, depending a little bit on the drug, but they get quite a lot worse by being jerked off their drug. So in a way, we're getting a frustration score. We're not really getting a depression score. We get the frustration with the side effects of going off, the withdrawal effects. Okay, well, this is our starting score after 10 days. And then half the group, they get back a drug that is very similar to the drug that they took. And the other drug get to continue in placebo. That means they get to continue in withdrawal. They don't get anything but a sugar pill, but they don't know it. They think it's a drug, but they get just sugar pills. And then you compare the two groups. The problem with this is that the group that gets back a drug that was very similar to the drug that they had is like a smoker who has tried to quit smoking for 10 days, and then he starts again with a different brand. Okay, most people would say, oh, whew, most people who have smoked, they will say, oh, that's a relief, I get back my drug of choice, nicotine. Or people who have been drinking heavily and then they stop drinking for 10 days and then they feel worse and worse and worse, and finally they get to drink again, but they drink vodka instead of whiskey. I don't think most people would mind. But this is the problem, that they get back a drug that is very similar to the drug they used to take. And we compare this to a group that is in withdrawal. Even when we do this, the group that is in cold turkey withdrawal, they're doing quite well. They're doing so well that after 8 weeks, when it's supposed to test in a way how effective the drugs have been, just wait one more week and the placebo group would be at exactly the same score as the group who got back a drug. Okay, so it's pretty good. It's pretty good, the placebo treatment. That means full withdrawal after 8 weeks. They're still okay. But and the difference is so small that not even patients don't notice it and doctors don't notice it. It's 3 points on the Hamilton Depression Scale maximum, less than 3 points, and we need more than 3 points, usually 7 points, to notice a difference at all. So the difference is not really noticeable even from being on cold turkey withdrawal and having been back on similar drug for 8 weeks. So the difference is so small that nobody can really notice. Now, the case is probably that some people get so much worse by going back on the drug that it counters for some people who actually get a little bit better. But we don't know. Nobody has been able to find a special group that actually we can predict will do better. Okay, so one group gets back and they are not really different. But, and this is the interesting thing, the pharmaceutical industry have also done a different type of drug analysis, and that is the withdrawal studies. That means they want to show that if you withdraw from your drug, you're going to do worse than if you continue taking the drug. And in this kind of research, they do exactly the same. It's just that they let one group just keep on with their drug, and one group is abruptly withdrawn from the drug, but they don't know, they're getting placebo. So it's very, very similar. And then they see that the group who's withdrawn, in a way, they do doubly as poorly as the ones who are kept on the medication, kept on the drug. And that means that actually the placebo group should be expected to do doubly as badly as the drug group in the other research. Okay, so we should calculate that in and say that, okay, we expect the placebo group to have double as many depression symptoms as the drug group after 8 weeks. But they don't. After 9 weeks, they have exactly the same scores. Okay, so that means that actually the antidepressants are worse, because we should expect the placebo group to be double as bad, but they're not. Okay, so you can't have your cake and eat it too. If the drug companies prove that you have double the number of relapses on placebo, okay, you can't compare this group to the group that is getting back the drug. It means that actually the placebo withdrawal is doing better in the 8 weeks trial. So the 8 weeks trial is not worth anything. We can't say anything about it, only that probably it is better to go off, because they are doing the same after 9 weeks, and we should expect them to have double the problems, but they don't. So we might say that this kind of research shows that we cannot trust anything that is out there when it comes to randomized clinical trials, randomized controlled trials of antidepressants, and it's exactly the same with antipsychotics. It's just that it seems like they're a little bit better if they are put back on a drug, but the relapse studies shows that you get 3 times as many relapses if you are in the placebo group. So the drugs don't really work compared to placebo. They don't, because the placebo group is not a placebo group. They are a withdrawal group. And even if some people might like the effects of the drugs, they should know that we don't have any real research that proves that they are effective. People want to prove that they are effective, but they are not. So the solution is, there's so many other things you can do than drugs. Therapy for depression works very well. Therapy for psychosis can also do really, really well. And especially with psychosis too, to have a psychosocial approach where you also take care of the social part of the problem, that people don't stay alone, for instance, for long periods, also works very well. Okay, so that's a hopeful message for today. You probably don't have to take these drugs because there are so many other things that you can do.